Hey everybody, today we have a question related to the GI system, so let's take a look. A patient with a long-standing history of alcoholism is admitted with bleeding esophageal varices, certainly one of my favorite type of patients. The nurse would anticipate all of the following except, well, A, administration of sandostatin, octreotide, B, esophageal band ligation, C, administering lactulose, or D, preparing for surgery stat. So the nurse would anticipate all of the following except. Take a moment, look it over. Well, guys, we can certainly anticipate the administration of sandostatin. We certainly can anticipate the possibility / probability that we'll do esophageal band ligation, also called, O-band ligation or O-ring ligation. Basically, we're putting a rubber band around the varix, the bleeding varix. So certainly can anticipate that. Administering lactulose, we know we're going to be doing that in order to excrete ammonia out in the stool, via the GI tract out into the stool. We can certainly anticipate doing all of those things. The thing that we can't anticipate is getting the patient ready for stat surgery. Like, what are we going to do exactly? So when we're talking about a ruptured varix, the patient's going to bleed like crazy. We have to stop the bleed. Certainly, the purpose behind sandostatin is to decrease perfusion to the bleed. The esophageal band will band the bleeder, and eventually it will die, slough off, and be excreted in the stool. Lactulose really deals with the ammonia aspect of it, since with a bleed, when blood breaks down, it increases the ammonia count. So other things we might use would include things like sclerotherapy in order to sclerose the bleed. We inject it with a sclerosing agent, and sclerose literally means to scar. So if we're using a sclerosing agent, it's an agent that's going to cause scarring in order to stop the bleed. The other thing that we can possibly see and anticipate is the TIPS procedure. So the transjugular intrahepatic portosystemic shunt procedure, where we create a shunt that decreases portal pressure, and that shunt is between the hepatic vein and the portal vein. So those are all things that we can expect. Getting the patient ready for the OR, not so much. There's really nothing we're going to do in the operating room. So that's all I have for you today, and I will see you again with another question tomorrow. Take care. Bye-bye.